Without interruption, I bring you your Honors Anatomy Physiology Midterm Marking Period 1 review. Recall that only 7 out of the 27 questions are on this marking period, which focuses on Chapter 1, Terminology and Introduction, Chapter 4, which is Tissues, and Chapter 6, which is on the bone, specifically the long bone structure and bone tissue. So we'll start in Chapter 1 talking about the body cavities. There are two major body cavities, the dorsal body cavity and the ventral body cavity. The dorsal cavity is straightforwardly subdivided into the vertebral cavity and the cranial cavity. The ventral body cavity is subdivided into the thoracic cavity and the abdominal pelvic cavity. The thoracic cavity is further subdivided into the pleural cavity and the pericardial cavity. And obviously the abdominal pelvic cavity is broken down into the abdominal and the pelvic. You should have an idea of an example of an organ contained within each cavity. The vertebral cavity contains the spinal cord. The cranial cavity contains the brain. The pleural cavity contains the lungs. The pericardial, the heart. The abdominal, the digestive viscera or organs. And the pelvic cavity contains the bladder and the reproductive organs. Moving on. The planes or body sections, of which there are 3. A cut like so would be considered a transverse cut or section of the body, and this splits the body into superior and inferior parts. A cut like this would be a sagittal section. It's exactly in the middle, it is mid-sagittal, and this splits the body into right and left halves. And if you could imagine a cut along the lengthwise plane of the body is termed a coronal or frontal section, and this splits the body into anterior and posterior pieces. Chapter 4, Tissues. We got a nice chart in your notes here. There are 4 basic tissues types. I guess we'll title this. There are 4 basic tissues types: muscle, nerve, epithelial tissue, which lines an opening, and connective tissue. We spent some time in the prior review discussing the 3 types of muscle tissue, so we won't do that here. Cardiac, smooth, and skeletal. Nerve tissue will be discussed in the 3rd marking period. Epithelial tissue is broken down into simple and stratified, simple epithelial tissue being consisting of one layer and stratified of multiple layers. And then simple epithelial tissue can come in three shapes. It's flat, it's squamous, cube-shaped, and column-shaped. Or called the fourth kind of simple tissue, pseudostratified columnar, which looks as if it's stratified, but is not. It has some cells are tall and some cells are short, which gives it a somewhat stratified appearance. Stratified tissue would also follow the similar naming rules. There would be squamous, possible, cuboidal, columnar, and the other stratified tissue possible would be transitional, which transitions from stretched out to normal cube-shaped, as in the bladder, which can change volume due to when it's full or when it's empty. Connective tissue, 4 subcategories of connective tissue. Maybe go a different color here. There's loose, dense, blood, bone. I think I said 4 subcategories. This would make it 5. And cartilage, which I can't quite fit there. So loose connective tissue, dense connective tissue, blood, bone, and cartilage. In loose connective tissue, the fibers are not apparent or not tight. The subtypes of loose connective tissue are areolar, adipose or fat tissue, which has no fibers, and reticular tissue. Dense connective tissue, which the fibers are much closer together and make the tissue stronger, as in the functioning of a ligament, or in the deeper layers of the skin, include dense regular and dense irregular tissue. Again, there are no diagrams on this exam. Blood, there are red blood cells and white blood cells. Red blood cells being more common. Bone comes in 2 varieties, compact and spongy. And cartilage comes in 3, hyaline, which is the more common one, elastic, found in the ear, and fibrocartilage, found in the knee and in the vertebra. You should have an idea of your cell types. Fibrocyte or fibroblast is the generic cell type found in many connective tissues. Chondroblast or chondrocyte is what's found in cartilage. And osteoblasts and osteocytes is what's found in bone. As far as the skin, there's only one question on the skin. You should have an idea that the integumentary system is a system because the skin consists of many different organs. Besides the skin, you have hair, nails, oil glands, sweat glands, muscle, the erector pili, for example, nerve, and blood vessels. So that makes the integument a system. And focusing on the skin, you should know that the skin is the largest organ in the body. Finishing up with Chapter 6 and the long bone. The expanded ends of the long bone are referred to as epiphysis or epiphyses, plural. The shaft is the diaphysis. And in between is what we call the growth plate or the epiphyseal line. You would have one on each end. When the bone grows, the diaphysis pushes away from the epiphysis, extending the bone from the inside out. Recall that the diaphysis is made of compact bone surrounding a yellow bone marrow, and the epiphysis consists of spongy bone surrounding red marrow. You should know the difference between osteoblasts and osteoclasts. Osteoblasts are your bone builders. They build up bone. Osteoclasts are your bone breakers. They leach calcium out of the bone, for example, if it's needed for muscle contraction. Normally these two are imbalanced, but we said in diseases such as osteoporosis, in which the bone is abnormally porous and weak, the osteoblasts are decreased in their production and the osteoclasts are increasing in their activity, which does not keep this balance that we're talking about and leads to the disease state referred to as osteoporosis. Good luck.